And very good evening to you and welcome to Newsline Live. We broadcast as we almost always do from the Newsfirst studios in Dorset Street in Colombo. And as the numbers rise, the CV19 figures rise in our country and worldwide, I thought we'd have a medical discussion this evening to find out what we can do, because after all, COVID-19, this pandemic, is without doubt a national crisis, and we'd like to ask from a medical perspective whether this government and whether our legislators and our authorities are doing everything possible medically speaking from a medical perspective. Very good evening to you, Dr. G. Weerasinghe. Thank you for being on our program.
Good evening.
Now, Doctor, I'd like to ask you this question. Is this a national crisis?
Of course.
From a medical perspective?
Yeah, of course. You see, actually, I don't speak as a doctor alone here, right? Therefore, I mean, I want to see in a more broader way. I want to look at this issue. For us, this is a global crisis, right?
Yeah.
Global crisis due to this COVID-19 pandemic. It is actually more than a health crisis. I mean, you can see the entire world is affected. You see, the economies are shattered, right? There is no production that happens in the world. There is no tourism in the world. You see, there are no services in the world, right? So the enormous economic impact on the globe, right? And
yeah.
People say there is even more than the Great Depression that we had in 1920s, right?
Now then, I want to ask you this. HIV used to consume several million deaths before it started coming under control. Last year, the figure was, I researched it today, 690,000 worldwide figure. Now, in this fight against HIV, which the whole world joined hands, if you look at it here in Sri Lanka, the distribution of contraceptives is quite robust here in Sri Lanka. But so that's the one item they felt that they could control the spread of HIV with contraception. Now then, when you look at COVID-19, we have this item here, which is the mask, which is 1/3 of what we've been asked to do. Face, which is the mask, and the hands, and we've got sanitizer or we've got soap and so on. And the other one, of course, is the space. Now then, when it comes to the masks, for example, if you think that 62% of our country, the workforce, is unskilled, and a large number of that is daily waged and so on, and we are an emerging economy, so we've got lots of poor people. But I don't see any masks being distributed free, like the contraceptives. What can we do?
Yeah, I mean, that's very good example that you are, or rather parallel way of thinking that you are bringing here, right? You see, when it comes to HIV, right, HIV prevention is solely not depend on the medical side of it. Actually, there is no cure, right? No. I mean, we are controlling HIV, yes, with drugs, but then how do you prevent it? There are a lot of activities that there are preventive programs that are happening throughout the world, right? Yeah. It happens in Sri Lanka also, right?
This is like the distribution of condoms.
You see, it's not alone, right? I mean, distribution of condom is one of the very important, one of the very important one activity that happens there. But then, you raise awareness, and there are a lot of other things.
Yeah.
You see, but this is where that how do you say, now we say for an example in Sri Lanka we distribute around 4 million around 4 million condoms a year, right? But that is actually, those are the numbers that we distribute. But I can tell you around 10-15 millions of condoms are being, at least 15 millions of condoms are being sold, you see, yearly
in Sri Lanka,
outside
outside this 4 million.
Outside 4 million, right? So now my point here is that now when it comes to COVID, right, you see that actually a national crisis, as you asked me at the very beginning, it's a national crisis. So when we are, why do we say national crisis? We don't have to explain. The numbers speak itself.
The numbers speak for themselves.
You see that now.
The average is about 500 now.
Yeah, around, if you take an average from October to November, it's around about 350 cases a day, something like that, right? And then there are deaths, you see.
Well, that's what I mean. We were sort of steaming along with about 12-15 deaths, and suddenly it's today I think it's 99.
Yeah, so the cumulative number, right? So you see the government is doing its best, and actually when it appeared first, we were able to control it. But then when this second wave came up, you see, it looks like what we have been doing is not enough to control the situation, right? But it looks like that we continue the same path. So this is why you see that we think that there are certain other things that we can do to control the situation. And if you allow me, right, I can give our views on this matter, right?
Yeah.
One of them is actually to make this, there is a response. There is a response for this situation in the country, but make it really a national response.
How would you suggest?
See, my suggestion would be for the government to have a political mechanism where at least the political parties that are represented in parliament to have to be involved, to involve in this activity,
but,
a
Doctor,
political.
Why bring politics in?
Yeah, you see, not politics. This is not politics. You see, now I mean we have to face the reality, right? The government is there. You see that government is governed by political parties.
Yes.
But then there is a at least half 50% of the population of this country politically is not represented in the government, at least I'm telling you.
But does that
so what my point here is that let people see, you see, this crisis is being faced as the entire nation.
So I get it. What you're saying is we need the political parties so that you can reach everybody.
And
you have your voters, they have theirs, and so on. Everybody comes in together.
You build the confidence in people, and don't allow certain certain political forces to have undue advantages in this situation. That kind of things also are happening. You see, encouraging people to agitate and kind of thing.
What about communities?
Yeah, and then it's very important that. But then the second most important aspect would be the involvement of communities. You see, now for us, you see, we have been seeing during last 1 or 2 weeks, you see, people are coming to media and threatening. You see, they are talking about the impending deaths, the deaths without having drums, the death without having flags. This kind of talks we kept on hearing. I don't know why. Then they were blaming for not wearing mask and for not keeping distance. I really don't know why they wanted to blame people. Don't blame people. Take people into your trust people and involve people, right? This is what is happening in HIV control. You are asking me about condoms, right? You are talking about contraceptives. Actually, we call them condoms, right?
Yeah.
Condoms, right? Okay. we distribute condoms annually, around 4 million condoms in this country freely. You see,
Who picks
now
the
why,
tab up? Who picks the
let
tab
me,
up?
let me explain you why do we want to do this, right? Because, now we can, this is to control and prevent the spread of sexually transmitted disease and HIV. You see that to get a person to wear a condom when they have sex is a behavioral change. You are asking to wear a condom whenever they have sex, when they have sex with more than one partner.
Right.
Well, okay, if they have sexual relationships with more than one partner, we advise them to wear a condom so that they don't acquire sexually transmitted infections and HIV. When you say this, there may be people immediately understand that and they get into that practice.
And maybe others might turn the TV off now.
There may be certain other people, right, who do not want to do that at once.
Right.
You see that they have to change their attitude towards using these condoms, and then even after doing that they may not be in a position to do if they can't buy a condom.
Because of the stigma, the embarrassment.
There are so many other things, and they don't have the
finance.
Finance.
Ah.
I mean, you can't assume, you can't sit in a room and assume, okay, everybody on road can buy condoms. The same applies here.
To these.
To the mask
to the
also.
masks, exactly.
Now you can say, okay, 500 times over your TV that, okay, wear a mask, and over radio, but then you see, then there may be certain people who can't buy them. Now
that's where the community comes in.
And you now, little while ago you said economy is crashed, and 60% of workforce in this country is engaged in
unskilled work,
actually informal, right? They day-to-day earners, right? Now nothing of that kind of, I mean, those things are not happening in the country. So where do they find money to buy their mask? You see, so this is why we say, right, involve communities, and where necessary provide mask freely, right, free of charge to those people who are in need of them. Empower communities to work for communities within their communities.
Do you think,
there should be a community-based response?
Yes, but do you think that Dr. Jayasundra, who may be watching this, is having an instant headache because now he may think that we all want him to pay for these masks, the free masks? Do we have enough money to do it? If not, how are we going to sort this issue out? Because the distribution of these masks to everybody is absolutely critical and essential.
Yeah, you see, now a little while ago I told you there are about 20 millions of condoms, even more than that, are being used in this country a year. Out of that, around 15 million are being bought, or rather 16 million are being bought by people.
Okay.
So there are only around 4 million we distribute.
Yeah.
The same applies here, right? Not everybody, now people don't have to give me a mask. I can buy my mask.
Yeah.
Right? But then there are certain
others who don't.
There are certain other people who can't. This we need to provide for those needy people.
Right.
That we have to have a program involving communities to look after their communities.
And if we go to the communities, I'm sure Sri Lanka is very high on this giving index. We are a nation of people who are always giving. We're helping family, friends, colleagues, and so on. Sri Lanka is proud to be so. I'm sure we all are, and the figure is quite high. So if it's at a community level, and if you can afford it, I mean, one of these boxes is about 50, is about 20 rupees each. I'm sure you get it cheaper if you try hard enough, you buy. But perhaps people who can afford it can think of the people who don't have money and so on, and help them distribute these things free, because you're doing your part for this country, being patriotic, and you're doing your part instead of sitting down on your do-nothing seat. Is this a good idea? Can people get involved in this?
I mean, there would be many avenues, many new initiatives once you involve communities, right? These things will come up. these things will come up naturally, right? Without any effort, people will come forward, right? But only thing, this initiative will have to come from top, right? I mean, that involving communities in this prevention, program. Right. But now not only mask, when it come to this, so washing hands, yes, and these kind of things.
I'm going to ask you about hand sanitizers and soaps and water and so on after this short break. So remember, we're going to talk about safety and the distribution of masks and being very careful about the medical advice after this short break. Do join us. It's Newsline Live.
Newsfirst, Newsline with Faraz Shauketaly.
And welcome back to Newsline Live. I'm in conversation with Dr. G. Weerasinghe. Now then, Doctor, we've spoken about the need to distribute masks, make them available to people who can't even afford that, right? And in this challenging economy. But what about the bigger picture, which is the vaccine?
Yeah, you see, now in a way the final solution is going to be a vaccine for us, right? But the world is making advances, by every passing day towards vaccines, and it looks like Russia is the most advanced in this area. And we know that they have requested WHO for pre-qualification, right? That is how it works. Whenever you produce a drug or whatever, you have to get the WHO approval. Russia has applied for that, but then China is doing, and then there are things that are happening in United States, in UK. All these things are happening, but yeah, but then we need to understand very correctly, right? Vaccine, yeah, it is the solution, it is the answer.
Even the WHO is only saying 20% to Sri Lanka.
Yeah, but now you see, you need to produce at least 8 billion doses of this vaccine. Now look
in Sri Lanka.
No, for the entire world.
Oh, okay.
8 billion doses.
8 billion.
Because 7 plus 7.8 billion or whatever. Yeah. That is the world population.
So 8 billion is required.
You need to produce them in factories, in whatever wherever, right? And then you need to from those factories you need to bring them to your village, your town, right? It's a long process, right? You need to produce them, then you need to transport them, then you distribute them to needy areas. While you are doing, you have to maintain this so-called cold chain. Yes. It's a huge process. So therefore, the most optimistic situation would be, you see, where somewhere in next year, mid of next year, if we are going to be fortunate that we will have some. As you said, from WHO, this 20%.
That's about 4 million.
When you take our population, right, it's about 4 million Sri Lankans.
Yeah, but that's the 20% of 21 million.
Yeah, I mean, slightly more than that, right?
So about 4 million.
4 million, right? But for Sri Lanka to have this so-called herd immunity, at least about 70% of population need to be vaccinated. 70 million is about
14 million.
14 million out of our population.
So we need another 10 million.
Another 10 million, there is a gap, right?
Who's going to give it to us?
You see that, I don't know who is going to give them freely, but then if it comes to, purchase or buy them, we still will have to do that, because, now we have to save the lives of the people. Whatever the
well, even if it's $5 each, and if it's 14 million, it's only 70 million.
Yeah, that is the cost in the factory,
yes, but
right?
The government is not after making profit here.
Yeah, but then you need to transport, and there are other things, infrastructure, cold chain, and kind of things.
But it sounds very little when you compare the amounts of corruption elements that have gone around in the country.
Yeah, of course. You see, the cheapest what we hear is the Russian vaccine, around $10 per person, $10 per shot, right?
Yeah.
So why actually the government needs to take a proactive stance on this matter. It's good that we are getting some certain amount from WHO in the COVAX program.
Yes, we are very grateful
in collaboration with Gavi, World Immunization Program. That's very good. That's very good. But the rest, the gap, of 10 million at least, need to be filled by the government resources, and for that we request government to take a active stance and already start negotiations with countries which are trying to produce these vaccines. We don't know whether the government has taken any action in that direction. At least we haven't heard of. We haven't heard of. So you see that therefore these very important few elements that we are proposing here. One is to have a political, to make this response a really national response, right? To have a political mechanism of political parties, so that you meet and
so that
discuss.
everybody is working towards
same objective. The second is the very important community participation and providing some of these means of prevention, such as masks, even I don't know, even to providing soap if you want, providing some infrastructure facilities in this Colombo highly congested areas, such as toilets and kind of things. To take active program, to have an active program by involving communities, right? You need to involve communities in this response. Without doing that, we can't do it. I have to be very clear on that matter. And then to take a very active stance on vaccines. These are very, very important areas in responding, in facing this national crisis.
And Dr. Weerasinghe, whilst we're waiting for the government to put this whole thing into action, is it a good thing for communities themselves to take the bull by the horns, become proactive, and start distributing masks, at least masks, to those of our citizenry who can't even afford that?
I fully agree with you. I fully agree. I can bring here an example. Actually, I read this on a national newspaper last week. This a village called Kudahalmillava in Anuradhapura district. You see, they are already implementing this community participation program, probably with the guidance from the community medicine department of Rajarata University, medical faculty. What I read there is that the women of that village, they have been empowered by educating, right, of this issue, right, about the disease, and how they can prevent it, kind of things. And now they have organized that village in such a way that that they are not going to contact this infection, right? I heard that the masks are there, and they all wear masks, right? Everybody in that village. And then I read that there are pipes that are being set in front of each house of that village, so that people always, whenever they go out and whenever they come, they wash their hand. And for shopping kind of things, they send one person from the house, right? No, many are not going. And then social distancing they are keeping very well, and no gatherings. All these things actually happen through empowering women of that village. And so much so, I heard that they have identified even a house in that village, if anything happens, for that person to be quarantined, right?
Well, that's good. That's a good story from the community. Dr. Weerasinghe, thank you very much for being with us here on Newsline Live. And as we leave you tonight, let me just remind you that the most important things that we, the people, need to do is, face, which is your mask. Put your mask on like that, and use your sanitizers, or you can use soap and water. And finally, you need to keep your space. Don't forget to do that. And as we hope that you will remember and practice this, and all those who want to start distributing masks to those underprivileged and who can't afford them, please start doing so soon. Take care. Great evening ahead of you, and God bless.
Thank you.
Thank you.